I'm Dr. Nilesh Patel, and I'm part of Texas Bariatric Specialists. I'm a bariatric surgeon that was trained specifically in minimally invasive bariatric surgery in Pittsburgh, and I've been in practice in San Antonio for almost 15 years. One of the most important things to me in my job is helping to make dreams come true. And that's pretty simple when you talk about obesity and being able to ride a roller coaster or go to a quinceañera or fit in an old wedding gown. Those are the kinds of dreams we're talking about, and bariatric surgeons can help make that happen. You know, metabolic syndrome is really a constellation of findings that we'll find in a patient who is overweight, has high blood pressure, elevated blood sugars or insulin resistance, and has a problem with cholesterol. When you have 3 or 4 of those components, you have metabolic syndrome. And that's how we put this cluster of symptoms and signs together to be able to define a patient's risk profile. And for a long time, people just thought that obesity was the disease. The fact of the matter is that you could be 300 pounds overweight and not have metabolic syndrome. High cholesterol and elevated blood sugars, they all come together to cause metabolic syndrome, will be defined as metabolic syndrome. But the thought process behind coming together to come up with metabolic syndrome emphasizes the fact that obesity is just one of the risk factors that leads to these life-threatening conditions that we're talking about, right? So you could have metabolic syndrome without being truly obese. It doesn't have a BMI truly, attached to it. It's scary because we shouldn't be thinking that this is a disease for people that are just truly overweight. Unfortunately, metabolic syndrome is deadly. You're two times as likely to have a heart attack or a stroke. You're seven times more likely to get diabetes, and you're much more likely to die prematurely. You have 2 times more likely chance of developing a heart attack or stroke, 7 times more chance of developing diabetes. When you put those 2 risk factors together alone in the metabolic syndrome risk factor, you will lose at least 10 to 15 years of your life expectancy if you don't treat metabolic syndrome. And so we have a complete gamut of ways of being able to help patients in regards to being able to help control those conditions, help resolve metabolic syndrome with healthier lifestyle changes. So we can start you with just a meal plan. We could supplement the meal plan with weight loss medications that have been designed to be able to help get the weight off and to be able to modify these conditions. And in the ultimate cases, we offer weight loss surgery with multiple options that are very effective in being able to cure or put these conditions into remission. So if you or your loved one think that you have metabolic syndrome, please visit our website or call us today.